because there's no prescription involved with that one. So that's like illegal.
Yeah, that sounds like practicing medicine without a license.
That's like drug dealing.
That's a felony.
Hi, everyone. It's Dr. Dinh, board certified dermatologist. We're diving into part 2 of our GLP-1 conversations. I'm joined here today with my dear friend, Dr. Lindsey VanDyke.
Good to be back.
So she is double board certified in internal medicine and endocrinology. She's an expert in GLP-1s. So we are so grateful that she's here today.
My pleasure.
We're going to move on and do some FAQs from our patients, frequently asked questions. Our patients were really excited when they heard that Dr. VanDyke was going to do a podcast about this topic. So, number 1, on average, how long should a patient be on the medication if they're taking it for weight loss?
Yeah, contextually, we talk about these meds as a forever medicine because, as everything we've talked about, your metabolism's going to adapt. If we are treating a chronic condition successfully and we withdraw the medicine, then we expect things to go back to where they were in the beginning.
So essentially, that person that wants to take it to lose weight for their big vacation or their big event / wedding, it's really not a good idea to do it that way.
Not really.
Okay. No. Next question. There's online websites advertising GLP-1s. And they seem easier to get and cheaper for some patients. Can they get the medications there, and what's the difference?
These medicines that we are talking about are all under patent. And the patent holders do not distribute these molecules to compounding pharmacies. So we don't know where they're coming from. And I've been through this. I've called compounding pharmacies before and asked specifically, where are you getting it from? Is it pure? Can you give me a report that verifies that it is pure, that it is potent, all that? And the answer has been invariably no. They won't tell me any of those things. So generally speaking, it's too good to be true, and it could be harmful for that matter. In fact, Eli Lilly, which owns the patent on Tirzepatide or Zepbound, issued a statement not that long ago saying compounding Tirzepatide with B12 is a problem. It causes a side chain reaction that can be toxic. And so, B12, not a bad molecule. Tirzepatide, not a bad molecule. Together can cause problems. So these things cannot be presumed to be the same. There's a reason why they're cheaper. And transparency is key. I mean, the first promise we ever made was to first do no harm. So I'm only going to prescribe what I have evidence for.
That brings up a good point. So one is these compounding pharmacies, you don't know how they're making them, where they're getting it from. Could be coming from overseas. And then number 2, sometimes these websites will sell it directly to the patient, or you have a friend from Instagram or whatever, Facebook, that's selling it on the side. That's a whole different thing because there's no prescription involved with that one. So that's like illegal.
Yeah, that sounds like practicing medicine without a license.
That's like drug dealing.
That's a felony.
Yes. So I think people need to understand that, yes, this is advertised a lot, the GLP-1s, but where you're getting it is very important, and who you're getting it from is really important.
Right. And a year or two ago, it was a real problem with the price points. Okay, so people were turning to compounded agents because they were obviously more affordable. There have been such improvements with even the cash prices for these meds now that they are on par with what the compounding pharmacies were charging. So now you can get the actual patented molecule that you know is pure, that you know is FDA regulated, and you know where it was made, for about the same price.
What's that price number typically?
So the oral form of Wegovy is the most cost-effective of the GLPs, and that starts at $149 a month.
That's not bad.
Yeah, and then the price points change a little bit as the doses increase.
Okay. Who should be prescribing the GLPs? What qualifications should patients look for?
I don't think that you should have to see an obesity specialist or an endocrinologist to be able to access these meds because it would be a huge problem. Access would just be nothing. So being able to talk with your primary care doctor is a really fundamental way for managing obesity. What matters, though, in who you're choosing is that it's not just here's your script and we'll see you whenever. It's comprehensive. It's going to help with accountability. It's going to help you navigate the metabolic landscape as it changes.
So someone that's really going to be monitoring your whole journey with weight loss.
Dietary components, exercise components, all that stuff.
Great. Next question is, do I need to be on additional vitamins while on GLP-1s? You did mention protein supplements. Do you usually recommend anything else?
This is a loaded question. So a portion of our patients have had bariatric surgery in the past. And if you've had bariatrics, you got to be on your bariatric vitamins. That's just how that goes. If you have not had that kind of surgery before, then the answer to whether you should supplement depends on other things. Do you have other problems with vitamin deficiencies to begin with? Do you have any evidence of nutritional deficiency like anemia or neuropathy or things? If that's the case, yeah, we probably should be supplementing. What should you supplement with? Well, I'm loath to tell people to go spend a boatload of money. I say go to Costco, get a multivitamin. Or you choose your protein shake that's got one built in, like the Cornerstone that we prefer to use.
I think this is also a good question on my side too, because I get asked about collagen supplements. Are they helpful? If so, which ones do I recommend? You know, the data is kind of back and forth with this. I always say this. I say, look, the most important thing is a healthy diet.
Yes.
And getting the source through diet is the most important thing.
Yes.
When you're adding these, even a collagen supplement, a good quality one, you know, Jennifer Aniston is like promoting one. That's pretty good quality from what I was seeing. It's still not a complete thing. And there's a whole bunch of studies on collagen supplements. But I always say diet first. And if you are going to choose a collagen supplement, a hydrolyzed collagen supplement is preferred.
Okay.
Next question is, I lost a lot of weight and my skin is so saggy. What non-surgical options are there for me and when do I need surgery?
Take it away.
I think it's going to be patient dependent. So I always say if you are on a weight loss journey, you want to see your dermatologist in the beginning, at least after you lost your first 10 pounds. Most patients are pretty happy when they lost their first 10 pounds because they feel like their face gets more snatched. Tighter skin here and da-da-da. But then once they start reaching their 15, 20 pounds, 30 pounds, 40 pounds weight loss, things are no longer snatched. They're actually saggy. So this is when I see them. And I usually recommend, if they're seeing me early in their journey, to definitely be good with their sun protection, sunscreen. Maybe consider starting a vitamin C serum if they can tolerate that. That's going to be before you apply the sunscreen. Starting a topical retinoid that helps to turn over the skin, produce collagen over time. And then a little bit more aggressive procedures, not plastic surgery quite yet, but you can do microneedling, you can do monopolar radiofrequency. Those are some procedures that will help to produce collagen and has been shown to produce collagen. Eventually, if it's to the point where the skin is severe sagging to the point where I don't think it's going to be helpful, then I usually recommend a consultation with a plastic surgeon. So I do recommend patients keep dermatology in mind when they're doing their weight loss journey. Coming to us earlier rather than later is preferred. Next question. Oh, this is a great one. This is a patient scenario. Postpartum patient, gave birth a year ago, having a hard time losing maybe the extra 20 pounds that was gained during pregnancy. Do you think this patient can try a GLP-1?
It's not that she can't try a GLP-1. It's that she needs to be prepared for the context of what that's going to mean. It'll take some weight off, but then if you stop the med, then you're going to expect to see that regain, at least part of it. And so this is a case where maybe they are interested in the idea of that so-called microdosing, where just a whiff of it may help her meet her goals, and then you're getting the cumulative benefits that come on top of that these meds all provide with cardiovascular, kidney protection, and all that.
And then, speaking about, postpartum, prepartum, has there been any evidence about GLP-1s causing issues with fertility or helping with fertility?
We do show that women who carry a lot of fat mass, and this is real common in PCO, that if you begin to help reduce that fat mass, you kind of see an inverse relationship with fertility. And that would happen a lot back when we would give metformin for PCO a lot. Then all of a sudden they could get pregnant. Like, whoops, okay, we need to be aware of that. So I'm not aware of specific guidelines if you're planning pregnancy, what to do or not do in terms of GLPs, aside from the fact that we don't use them when someone is pregnant.
Okay. This is a question I added in. It's about the side effects of GLP-1s. I know there's a lot, so we don't have to go over all of them, but a big one that a patient asked me was, is there a potential risk of it causing cancer?
Yes, I'm glad that you asked this. So this class of medicine has carried a warning about a very specific type of thyroid cancer, and that is medullary thyroid cancer, which only makes up about 1% of all thyroid cancers. This was seen in the rats in the preclinical trials. These rats got much bigger doses of these meds than any human gets. And rat physiology is very different from human physiology. And this is why we can't just automatically say animal studies for any given drug or compound are going to be A-OK in humans, right? So there have been no documented medullary thyroid cancer cases in GLP users since those animal trials. And that's over 20 years of time. I get a common question related to this, that I've had papillary thyroid cancer. Can I use these meds? And the answer is unequivocally yes, you can.
Okay, very good. And then the last patient question was, I'm hearing a lot about GLP-3s on Instagram, Facebook, TikTok, whatever. Can you tell me a little bit more about that?
So this is pertaining to a new compound known as retatrutide. It's called triple therapy. So GLP, like semaglutide, GIP, like tirzepatide, and then this third one is a glucagon receptor action. And Lilly just published a headline recently that showed 28% fat loss on average over an 80-week period. So as good as what we have on the market right now, we expect that retatrutide is going to blow it all out of the water.
So the GLP-3s are going to be the next big thing.
I think so. Yeah. It's changing the face of bariatric surgery. Absolutely.
Very exciting things on the horizon.
It's totally. The next 5 to 10 years of obesity med development is going to blow your mind. There are combination therapies being investigated right now that help promote fat loss with maintenance or enhancement of muscle mass.
Awesome.
Yeah.
So, Dr. VanDyke, I always like to end each segment with what's the truth. So if you could just name your 3 top truths about GLP-1s that you want the listeners to take home, what would those 3 truths be?
Number 1, obesity is complex. There is no smart bullet therapy. I wish there was, because doing the work is very tough, right? Number 2, these medications are marvels of engineering and scientific achievement. They confer so many benefits beyond weight management. And then number 3 is, I tell the patients all the time, the more you do for you, your lifestyle, your diet, your strength training, and so on, the less we do to you. And that's always going to be money in your pocket and better long-term functional status.
So basically, don't look at these GLPs as an easy way out to lose weight. You still got to do your part.
Yep.
And exercise, eat protein, be monitored, because you could certainly rebound and get that weight gain back if you get off the medication.
For sure. Yeah.
I think on a dermatological perspective, my 3 points would be, 1, Drink lots of water while you're on these medications.
3 to 4 liters.
Because that hydration part is really important for the skin. Because that's why we see patients who are coming in with really dull skin. It's just they're dehydrated. Number 2, start your topical skincare routine. SPF, vitamin C, retinoids. And then number 3, see us before you reach your end goal weight loss. See us in the beginning and the middle, because then we can really start doing some procedures that are helping to stimulate collagen. And then when you get to your end goal, we can start seeing if there's significant volume loss, like from the fat aspect where you lost a lot of fat, we can do different procedures like maybe filler or, biostimulators that can kind of help with that. So see your dermatologist sooner rather than later. Well, this was a great conversation. Thank you so much, Dr. VanDyke, for being here. If you enjoyed today's episode, please like and subscribe. And also, Dr. VanDyke does do telehealth. Can you tell us a little bit more about that?
Yes. So I'm based in Texas, but I am licensed in 7 states, and California is one of those states. So we see folks remotely all the time for all kinds of things, not just weight, but diabetes and general thyroid and other endocrine conditions. Because there's just not enough endos to go around at all.
You're so right.
Yeah.
You're so right. The wait is even long in California, several weeks even.
Oh, sometimes you're waiting a year to get into somebody. But with our practice, we typically are seeing new patients within the 2 weeks. And telemedicine just allows so much more accessibility across the board for anybody.
Absolutely. If you would like to book an appointment, you can go down to the bottom of the podcast today. We'll have that information written down for you. You can click on that. Otherwise, it is so great to see you today.
Oh, it's my pleasure. Thank you for the invitation.
Thank you. If you enjoyed today's episode, please subscribe, leave a review, and share the podcast with someone who might find it helpful. This podcast is intended for educational and informational purposes only. It is not meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. For additional science-based dermatology information, visit aad.org. To learn more about our dermatology practice, visit www.dindermatology.com.